Hello and welcome to another edition of Feel This Pain. I'm Ken McKim, and tonight we're going to be talking a little bit about something known as Chiari Malformation. What that is when part of your brain pokes out from the skull where it's supposed to be contained and bad things happen as a result. Take a look at these pictures. Here is a normal brain contained completely within the skull as it should be. And then here's a picture of a brain suffering from Chiari Malformation. You can see the tonsils, that's what they call the pieces of the brain there that are poking out, are extending past the skull, and when they do that, they impede the flow of cerebral spinal fluid, and that's necessary. Bad things happen when that gets slowed down or blocked. I guess basically put, Chiari Malformation is a serious neurological disorder where the bottom part of the brain descends out of the skull and crowds the spinal cord, causing bad things. And most people diagnosed with Chiari have at least 5 of these symptoms. You've got supersensitive nerves, migraines, excessive sweating, ringing in the ears, pins and needles, muscle spasms throughout the body, facial numbness on one side, a feeling of perpetual weight on your shoulders, backaches, and there's more, legs that feel heavy or like they have glass in them, paralysis of limbs, seizures. And then there's the cognitive issues, memory, language. You can even lose IQ points from having this disorder. And wait, there's more. If there's something called cranial nerve compression involved, then you get more serious symptoms. You get things like sleep apnea. And you might think that's not a big deal. It is. Sleep apnea, when you have that, you stop breathing temporarily, but you're still not breathing. That's not good, obviously. You can have gagging, swallowing difficulties. You've got facial numbness, something called syncope, which is a fancy term for losing consciousness. If it continues and it's not treated, then you get into fatal complications, things involving your brainstem, cardiac arrest, or cerebral hemorrhage. This is a very serious condition, okay? So is surgery an option? Well, yes. Is it pleasant? No. And surgery, major surgery such as this, involving playing around with your brain and your spinal cord, always carries the risk of complications. You could come out of it worse off than when you went in for the surgery. It's a risk. It's a calculated risk. This particular surgery, let me get this right, is known as a posterior fossa decompression. What is that? That's a fancy way of saying we're going to go into your brain and cut out pieces of your skull. Okay? So they go in, they remove pieces of your skull in order to lessen the compression. Does it work? Yeah, it does work. Some people do find relief this way, but again, this is major surgery. Take a look at this picture. This young lady had the surgery not too long ago, and as you can see, that's a fairly big scar. It's painful. Recovery from surgery is painful. And again, there are no guarantees. A lot of people, they flounder for years just dealing with the symptoms of this because not a lot of doctors are familiar with this condition. They've never heard of it, therefore they don't look for it, and this gets misdiagnosed as other things. So if you want to learn more about this condition, there are some great websites I was referred to. I will include links to all of them down in the video description window. Also, there is a wonderful support group on Facebook. I will include a link to that page as well. They welcomed me in and answered my questions about this. But if you know someone with Chiari Malformation, know that they are dealing with a very serious condition, and give them the respect and the compassion that they deserve. And that's unfortunately all the time we have for this week. If you have any questions, please send them to me, ken@don'tpunishpain.com. You can also follow me over on Twitter @don'tpunishpain. So thank you so much for joining me, and until next time, I'm Ken McKim. You take care.